Hi guys, welcome back to my channel. I'm Christiana. I'm a certified nursing assistant, a certified surgical technologist. I have my bachelor's of science in psychology, and I'm currently right now getting my bachelor's of science in nursing. Today I'm going to be talking about 5 quick easy tips to pass your surgical tech exam. Tip number 1 is knowing what's sterile and knowing what's not sterile. Mastering these techniques will be something that is very key to you passing your exams. Knowing that you can't reach over your sterile field, knowing that something becoming wet means that it's contaminated, are very important key steps to making sure that you understand the main topic that will be asked about on the surgical tech exam. The next thing, number 2, is knowing the categories of your instruments. So, for example, you know that you have bandage scissors as well as Mayo scissors. You know that under clamps, you have Kelly clamps, hemostats, cryos, and more. Knowing these topics and these broad categories, they can help you to kind of dissect what it is that you're looking at and help you to more file the instruments in your brain. The third tip is knowing your priority interventions. And when I say that, I mean, let's say that, there's a break in the sterile field. You're going to replace that instrument immediately, or the individual is going to have to break scrub, or you're going to have to break scrub. Also, knowing that if a count is incorrect that you do with your circulator, that immediately you notify the surgeon and you stop the procedure and you try to figure out what's going on. These are big things where the patient's safety is taken into consideration, as well as what you are doing as a surgical tech. Your job is to maintain sterility of that field and also to be very aware and keen of what you're doing. Memorize these very high yield content areas. So this could be your sterilization techniques, this can be your maintaining counts and how to do timeouts, and this can also be proper gowning and gloving techniques, as these are going to be really big portions of your exam. And my 5th and final tip is just to make sure that you keep on practicing questions. The best way, in my opinion, for preparing for any exams is to just literally go out there and do a bunch of practice questions until I feel like I've done too many practice questions. And you can honestly never do enough practice questions. And I know we all do not want to do practice questions. I get it. In nursing school, I am loaded with practice questions 24/7, but it will literally be your best friend. Good luck, guys. Have fun.